Have you ever wondered if something as simple as a cucumber could interfere with your medication? In this video, we will explore why you should avoid cucumbers if you are taking certain medications. Understanding these interactions could be vital for your health. Welcome to our channel. Today we're discussing an important health topic. If you find this video helpful, don't forget to like and subscribe for more health tips. Certain medications can have negative interactions with cucumbers. Here are some common ones. 1. Warfarin, a blood thinner. 2. Cyclosporine, an immunosuppressant. 3. Diuretics used for high blood pressure. 4. Antibiotics, particularly tetracyclines. 5. Aspirin and other NSAIDs used for pain relief. Let's break down why these medications react with cucumbers. Cucumbers contain a compound called cucurbitacin. This can cause gastrointestinal issues, especially when combined with certain medications. Here's a closer look. 1. Warfarin. Cucurbitacin can increase the risk of bleeding. Users might experience unexpected bruising or bleeding. 2. Cyclosporine. Cucurbitacin may reduce the effectiveness of this immunosuppressant. This can lead to organ rejection in transplant patients. 3. Diuretics. Cucumbers have a natural diuretic effect, which can lead to dehydration when combined with diuretic medications. Users may feel dizzy or have low blood pressure. 4. Antibiotics. Cucurbitacin can interfere with the absorption of tetracyclines. This can reduce the effectiveness of the antibiotic. 5. Aspirin and NSAIDs. Combining these with cucumbers can increase gastrointestinal irritation. Users might experience stomach pain or ulcers. Let's hear from someone who experienced these interactions. He said, and I quote, "I was on warfarin and loved eating cucumbers in my salads, but I started noticing unexplained bruises and cuts that took longer to heal. My doctor advised me to stop eating cucumbers, and the symptoms improved." Pro tips for safe consumption. If you're on any of these medications, here are some pro tips. 1. Consult your doctor. Always ask your healthcare provider if cucumbers are safe for you. 2. Monitor your diet. Keep a food diary to track any adverse reactions. 3. Adjust your diet. Find alternatives to cucumbers, like lettuce or zucchini, which do not have the same interactions. 4. Stay hydrated. Drink plenty of water, especially if you are taking diuretics. Understanding food and medication interactions is crucial for your health. Be aware of what you eat when taking these medications. If you found this video helpful, please like and subscribe for more health tips. Stay safe and healthy.